Good afternoon, students. And in the DNA virus, and today I'm going to deal with the herpes zoster virus. Okay, so it is also called as a varicella zoster virus. Okay, so today our topic is a herpes zoster virus or the varicella zoster virus. Okay, so this herpes zoster is also known as a shingles. Okay, so means and these shingles, it is a one type of a viral infection, and it is also belongs to the family of DNA virus family. So what how it is going to be there here means, and these viral infection, it is going to be mostly affected to our nervous cells, okay, or our nervous impulses or the nervous transmitters, and from the spinal cord it is going to be transmit the infection. Okay, and whenever this kind of infection has been there, and it is going to be characterized by rashes of the blisters. So in the diagram you are showing that so in the same way the shingles is going to be appears, okay, like blisters, and it is very painful, but it is not a life threatening process, and it's a same like it is also a family of an chicken pox. Okay, so varicella means chicken pox only. Okay, so zoster means it's a shingles. Okay, so here, so both the conditions, that chicken pox and the shingles, so these two conditions is going to be caused. Okay, so that is caused by virus is what, varicella zoster virus, and that also caused by what, chicken pox, and along with that the infection is going to be transmitted. Okay, so the infection usually, okay, so these shingles in the picturization they are clearly explaining. See, so it is going to be appears like a blisters, and mostly the so chest side or the back, and where it is going to be occurs, and including face near to the eyes also, it's going to be anywhere on the body, but it include on the face and the ears, so it will not occur. So but area of the back, on the chest areas on the body, so these shingles is going to be occurs. Okay, so for now we will be dealing with the what is varicella zoster virus. Okay, so this already in the introduction I had told that. So varicella means chicken pox, and herpes zoster means shingles. Okay, and these are the two distinct clinically distributions. Okay, so the picturization also have shown you. So whatever the yellowish color you are seeing, that is chicken pox. Okay, and where the rash like you are seeing, that are the shingles disorders, and these two disorders and at a time, and it is going to be occurs. Okay, so chicken pox and along with the zoster shingles, so these two process they are going to occur. So the difference between chicken pox, it will occurs like a blister form, and where the zoster, and it is going to be occurs like a rashes. Okay, so these are the two different, and at a time the infection is going to be occurs. And already in the topic we have discussed, that is a DNA virus. Okay, so where the primary infections in the varicella chicken pox. So primary infection means what, first where, and this varicella zoster virus, so the person is attacked with the chicken pox, and later, and the person like recurrent infection, and this chicken pox or virus is going to be spread to the herpes zoster, or it's also called as, okay, shingles. Okay, so how it is going to be there in the pathophysiology, I'll explain you clearly. So what is primary infection and the what is recurrent infection. Okay, so shingles epidemiology. So already you know that epidemiology means how it is going to be transmitted. So what is the incubation period? Okay, so how it is going to be transmitted means direct contact. So whenever open sores or the shingle rash is there, whenever you are going to contact by the touch or some of the secondary process of touch, so then you are going to occurs, and can pass to someone and who are have the chicken pox. So the person who are having a chicken pox, and through airborne diseases, okay, through airborne or through by touching the person, or using some of the personal things of the patient, and it is going to be transmitted. So high incident rate, so anyone who had a chicken pox, and it is going to be transmitted to the other person, and the people who are above so 50 years of age, so because the person they are having a low immunity levels, so due to that the person is going to be have the high incident group of person. And incubation period and after occurrence of the chicken pox, and is going to be takes place to 10 to 21 days. We can see the incubation period of the chickenpox or the varicella shingles epidemiology. So now we will be step on to the pathophysiology. So how it is going to be transmitted here means whenever you are going to a direct contact, right? So and this pathophysiology, whenever you are doing, it's going to be entered through our respiratory tract. Okay, so what is happening here, whenever it enters to our respiratory tract, and this virus is going to be takes place in our lymph nodes and also our bloodstream. So after that and further these from the lymph node and the bloodstream, and it is going to be so transmitted to the our liver and the spleen. Okay, clear? So that is a primary transmission of the process. Okay, so in the diagrammatic presentation also I'll show you. So first how it is going to be there, first it is going to be enter through a respiratory tract, and from respiratory tract and has a viral multiplies, it is going to be transmitted to the lymph nodes and also on our bloodstream it is going to be transmitted, and it is this virus is going to be transmitted to the liver and the spleen. And what is secondary viremia, that is recurrent viremia, right? So what is happening here means, so in the secondary viremia, so it is going to be enter to our nerve endings. Okay, so directly, so the primary infection, the like blood in our blood and in liver and spleen, it is going to be transmitted. So whereas on secondary viremia, so it is going to be direct attack to our nerve endings, so our dorsal root ganglia and also the some sensory nerve ganglia and dorsal roots will be there, that is a nerve transmitter roots. Okay, and directly, so there it is going to be affected, and reactivation in the dorsal root ganglia. So what is going to be there in this, so the multiplication is going to be starts, and where the infection of the nerves and the dermatomy means the skin. Okay, and where it is going to be affected, and it shows some of the herpes zoster signs and symptoms. So that is a classification of pathophysiology regarding of herpes zoster virus. Okay, so here the pathophysiology has discussed how many two types, that is primary viremia, and the second one is what, secondary viremia. So primary viremia, so it is going to be transmitted by the viral replication by the bloodstream and the lymph nodes, it is going to be transmitted to liver. And whereas the secondary viremia, and it is going to be affected to our nerve endings, our sensory nerve ganglions, it is going to be affected. So later, and it is going to be multiplies and shows the infection and shows the symptoms of signs and symptoms of herpes zoster infection. Okay, so I'll show you the in picture wise and how primary infection is going to be causes. Okay, so here, so what is going to be this is chicken pox, right? Okay, so whenever you have a chicken pox, what is going to be happen here, and the sensory neuron, these are the zoster lesions. Okay, and this is a dorsal root ganglion and the thoracic spinal cord. So in the primary infection, what is happening here, and where the chicken pox is going to be shows only the infection over the bloodstream process, and where the zoster, and it is going to be transmitted to our dorsal root ganglions and the thoracic spinal column. Okay, so here again, okay, so that is regarding of zoster. Okay, so zoster lesions, and that is directly infected to our sensory neurons and the dorsal root ganglions and the thoracic spinal column, it is going to be affected. And whereas in chicken pox, okay, and this chicken pox and directly from our bloodstream or DNA route, and where the infection is going to be affected, so that is a primary infection. Okay, so recurrent infection means what, and where, and from the body, and the virus migrate to a sensory nerves, and from that it is going to be transmitted to the spinal cord, and where the activation of virus in the ganglion due to stress over the virus, and it is going to be cause what infection, herpes zoster virus, and it is going to be cause infection chicken pox, sensory nerves and DLA ganglia and spinal cord, and through bloodstream it is going to be transmitted. Okay, so just that is a diagrammatic representation of pathophysiology. So next we'll go for the causes and risk factors of the herpes zoster. So the age factor is more, already we discussed that 50 years of age group or more, and due to the low immune response, and also the diseases like for example weakening the immune system such as HIV AIDS and the cancer. So these are the two factors and which making our immune system to be decreases, so automatically, and where the infections is also going to be so transmits more with these kind of the disorders. And later cancer treatment, so what is happening here means, and whenever you are taking under radiation or the chemotherapy, so the person will have the low resistance capacity. Okay, so what is happening here means, and the shingles may attack these kind of the person who are having under treatment of cancer. And immunosuppress drugs like for example steroids, okay, that is a prednisone. So if you are using this prolonged use of steroids, and your body is going to be have stimulated against these kind of the virus infections. Okay, so next we go for the clinical symptoms. So what are the clinical symptoms means? So first one we'll see the initial prodromal stage. So means starting stage, what are the first signs or symptoms of shingles? You can see here, first one is a headache will be there, and feeling generally unwell, and myalgia, so weakness will be there, and fever. Okay, so these are the initial prodromal. And for next one is acute stage. So in the acute stage, what is going to be there here? A rash will begin. Okay, so in the picture you are showing, right, the first picture, so rash is going to be begins, and on the area of the shingles you will be having a itching and tingling sensation will be there. So because the nerve has been infected, so that infected nerve you have to be controlled. Okay, so due to that, and you are going to have the infection of the nerve process, and later a fluid filled painful rash will be there. So here second one, blister formation is there, right? So that is going to be formed, and this fluid filled blister so can break open and crust over within 7 to 10 days, and where the like same like chicken pox, within 2 to 4 weeks it is going to be clear out the infections. Okay, so it is going to be like that. Okay, the chicken pox, the blister formation, right, and the picture, the shingles. Okay, so what are the complications with these kind of herpes if you are not if we are unleft and untreated? So these infections is going to be uncommon. So first one is a post herpetic neuralgia. So post herpetic neuralgia means, so it is causing a severe nerve pain. Okay, so in this process the nerve pain can damage your overall immune system in mostly in elderly patients. And the ophthalmic shingles, where you can see in the picture, right, so where the surrounding of the eye you will have the painful eye infections you are going to develop with the complications of this. And next one is a Ramsay-Hunt syndrome. So Ramsay-Hunt syndrome means, and so the inflammation of the nerve, and it is going to be damage your brain nervous system, and that going to be lead to your facial and the ear infections. Okay, so in the picture you are showing, right, so the ear infection and the facial infection also it is going to be transmitted. And encephalitis, inflammation of the brain, and hearing problems will be there, and some of the bacterial infections on the skin also it is going to be develops. And the picture you have shown here, right, bacterial infection. Okay, so this is the cranial nerve involvement. So when the cranial nerve involvement will be there, so the person will have the facial sigils. Okay, so this is the picture. And was zoster ophthalmics, so eye. Okay, so the person you are seeing, right, so it is going to be like that. Okay, so what are the diagnosis you can make here means, so the diagnosis you can make is infected with the varicella zoster virus, the skin sample you have to take. Okay, and blood test you have to take, and in the blood test, and you can see the white blood cells increase, you can see. Okay, and management, so management like, and antiviral medications they can give, like for example acyclovir, valacyclovir, and the famiciclovir. So these three types of the drugs you can give, and should be started within 24 hours of the observation of the condition. Okay, and management of the post herpetic neuralgia. Okay, so the person with the complications, right, so they have to use cyclic antidepressants, like for example amitriptyline you have to use, and some of the opioids like methadone, morphine you have to use, and a lidocaine patch. Okay, so in order to over the pain, and some of the anticonvulsants like gabapentin, and in order to have depressed, in order to reduce the pain, and some of the capsaicin cream you have to use, topical anesthetics including benzocaine you have to use. Okay, so in the post herpetic neuralgia. And in the non-pharmacological treatment, you can go for apply the cold water compressors and the skin and the soak in a bathtub filled with the cool water. So whenever you are keeping like that, and so you will feel comfortable. Okay, and add finally the ground oatmeal to the bathtub and apply the calamine lotion to the affected area, and trim your fingernails, so whenever you are scratching, and that is going to be spread to the external parts also. Okay, and you have to wear loose fitting cloth, so it will have the more itchy and irritation will be there, so that you have to avoid. So what is the prevention you can make here means Zostar vaccine you have to use, and mostly the 60 years or 50 years of age group people that you have to use for this sigils vaccine. Okay, so it's a live attenuated vaccine, that's a single injection where they are going to give to your upper arm. Okay, so with this vaccine, so the side effects you are going to occur, that is redness, pain, tenderness and swelling is going to be there at the injection site, and the person will be having the headache also. So that's the side effects you can see with these kind of sigils vaccine. It is a live attenuated vaccines. Okay, so that is a prevention of the sigils vaccine. And coming to the prognosis, and already we discussed that the prognosis is common, and where the 50 years of age group serious medical problem it is, and where the person who are having a immunity, so they can easily can able to develop the process. Okay, so the prognosis is good, with or without treatment it is going to be subsided. So but in the nerve ending process you have to take care. Okay, so that is regarding of the herpes zoster virus. Okay, thank you.